Yeah, so I'm here to talk about data science in regulated industries. Obviously, I'm going to focus on healthcare, but I think the things that I'm talking about are relevant in banking and in other places. Okay, here we go. So I joked that I used to work with data. You can give a little bit of my background. I started in consulting, doing analysis for like antitrust cases and the regulatory side of big mergers. Then moved into tech, did things you hear about at a lot of tech companies. Facebook, worked on ad pricing and monetization stuff. Yammer, and then Microsoft after Yammer was acquired. I was working on like marketing and sales and customer success related projects. But now I am the CEO of this company, Mode, which I started with a couple other folks about 3 years ago. So as Ian mentioned, Mode is a place where analysts and data scientists do a lot of their work. It's a place to actually create new analytical work, but also a place to share that with other people in the company. So the people who use Mode are like people like yourselves who would attend a data science meetup, but also lots of other folks. And that's kind of like the first thing I'm going to focus on in this talk is just like some applications of how people are using data science more broadly within companies in regulated industries. The quick rundown on Mode. So the way that people create new work in Mode is primarily by writing some type of code, SQL or Python. The reason that we do that is because we are first and foremost supporting analysts and data scientists, folks who are like answering the hardest problems at their companies. And then we want to make it easy for them to take that work and share it out in a really sort of clean way with other people in the company. So a lot of the folks who are using Mode today are creating analysis and then using that to drive some kind of decision downstream, maybe not even in the analytics or data science team, but in some other team like completely across the org chart in their company. There's a lot of companies that use Mode around here in particular, a lot of names you might recognize, the Lyfts and Twitches, kind of people who are doing really forward-thinking stuff that's actually different from what I'm going to talk about today, right? So Mode is something that gets used in a bunch of different industries. The way that people are using it in regulated industries tends to be different because of the different types of data that they work with. So, what we hear about a lot at meetups like this, I think, is typically understanding user interaction with a product, other things related to like consumer apps or software as a service. Today it's a little bit different. So I want to tell stories about a couple companies that are doing interesting things. That's really the vantage point that I have now, is I see a lot of companies doing interesting things with data. And then I want to talk a little bit about attitudes and compliance and regulation and how those things all fit together. So first company I want to talk about is Aspire Health. It's a palliative care company. So they're not focused on the same typical things like Tristan mentioned, patient outcomes. That's actually not the number one focus of data science at Aspire. What they actually care about is operational efficiency. So they've got this team of nurse practitioners and a number of other folks, doctors, people who are helping with client care, helping coordinate care. So there might be like 5 people who work with any one individual patient. And coordinating across those 5 people is a data challenge, right? It's about surfacing the necessary information in order to properly direct their time to the right patients. So what they've developed is a bunch of internal tools so that they can surface schedules, right, and information about what's happening with each of these patients so that nurse practitioners can then do their job more effectively. They're using Mode on the very end of this, like they're sort of solving the meta problem. They're bringing that back and saying like, hey, how efficient are these processes that we've created? We have these sort of internal data tools. Let's feed that back in and understand that at a deeper level. Like, can we create more efficiency among these teams of people who are going out to care for patients? And as they start to scale, those efficiencies become more and more important. And in a lot of ways, that's like the business model, right? Really efficiently and effectively caring for all of these patients. Another one that I'm really excited about is Notable Labs. So heaven forbid that any of you should be in this position, but let's say you have some kind of uncurable cancer, right? Or you have cancer that's like not responding to treatment. You can send a biopsy or some blood to Notable Labs. They'll test it against hundreds of different drugs, all FDA-approved drugs. And then what will happen is maybe some combination of drugs has off-label side effects that are going to positively affect your specific cancer, right? So you can see like exactly what is going to work for you for the type of cancer that you have. That's complicated. Like, I don't actually fully understand it, but the way that they do the tests is they have like a big plate and they test, many samples with lots of different drugs right next to each other. And they have to do some complicated stuff to actually account for which drugs and which combinations of drugs are positioned next to each other on the tray. So there's all kinds of really complicated things happening on the back end, right? Similar to Clover, actually, right? There's a lot of complicated stuff that eventually works its way into like one thing, which is like a recommendation for treatment, right? Like the important thing here is what drug or combinations of drugs can a doctor prescribe to an end patient that's going to help them have a better outcome. The way that they're doing this is, they're feeding the results of this lab data into AWS, right? It's going into a database. They're putting it into Mode, and within Mode, they're setting up reports so that they have folks who are actually administering care or like interacting with patients. Those people can look up an individual patient and see like the effects of different drugs and which ones are going to be the best. And then from there, look at drugs and start to understand like trends, right? So when they see trends, they can start to look into like, hey, let's look at this drug and the interactions of all of the other drugs that we've tested it with across multiple folks. And then the next step is sort of like, let's predict new drug combinations that are going to work for a specific type of cancer where we've seen like certain things work in the past. So the sort of trend among these, and actually I have one more slide for Clover. Like in any other meetup, I would talk about the interesting stuff Clover's doing, but like Tristan did a way better job than I would have. I think there's a sort of like common thread among all three of these companies, which is that they are using data in a way that is affecting individual decisions on like an hour by hour, if not more frequent basis, among people who are sort of in the field doing something. And the way that this works is actually like, it's kind of interesting because we think about regulated industries as having these super archaic systems. And they do, like you might have to write COBOL. But at the same time, there's this other force, which is like modern ways of doing things. So like Clover is a modern company, right? I think I was like, when I was practicing this, I was using both hands. There's like modern companies, regulated companies that suffer with these like archaic tools. I don't know how to do this with the mic. The modern companies, right, they're working in this open and transparent way. Like if you look at these products, they're similar to Mode, right? Like we see ourselves in this group as well, of being places where you're creating things and also distributing them throughout your company, right? It's a place not only where like new stuff gets done, but it's a place where you can like bring someone on board and they're going to be productive because they're going to have all of the work that was done in this environment already, right? It's an appealing way to work because it's fast. But if you're a regulated company, you might not have access to all of these things. Like Dropbox, for example, when you share a link in Dropbox, it's like on the open internet and then anyone can access it, which is really a big problem if that contains healthcare information, right? If you have PHI or like if you're in banking and that has like, someone's credit card information, that's like a no-go. You're not using Dropbox. But there is this pull, right? Like if you think about regulated entities, there's a lot of opportunity. Just look at the amount of money invested in healthcare in the last couple of years, right? There's tons of opportunity there. Companies like Clover see it and they want to affect change there. And in order to do that, they want to do it in a modern way. So like there's this pull of like regulated companies towards modern things. And there's, because like, it's so easy to see the opportunity for companies like Clover, like a company like Mode or like a number of the companies, some of the companies on this slide are moving back the other way, right? They see the opportunity as companies to help folks in regulated industries. And so they are coming to meet them in the middle to create tools and workflows that are going to work for companies like Clover or Aspire or Notable Labs. So when we think about like what the problem is here, there's two kinds of complexity that make it tough. One is data complexity, which is a problem that many companies suffer. The major difference is that like for companies in regulated environments, you're not necessarily going to have access to all the tools to solve that problem, right? So like your problem might look like other folks, but you're just kind of handicapped from the beginning. Then there's the regulatory complexity, which is to say, like, you need to be HIPAA compliant. Or in other industries, right, you have to follow legal guidelines, other compliance guidelines. So I have some thoughts about regulatory complexity in particular. And as I was putting this talk together, I was thinking, like, Mode wasn't always HIPAA compliant. And at some point, we had to actually, like, make the decision to become compliant and to meet the sort of standards for serving companies in regulated areas. And when we did that, we realized it was actually not as hard as we thought. Like, people were telling us it was going to be really, really bad. And then when we got there, we were like, oh, this isn't too bad. And I think it has a lot to do with attitudes. And this is sort of like one of the main things that I've learned from this whole process in general is, if you have a certain attitude that is like coming from this modern tool a little bit back, like if you're thinking back the other way, then a lot of this stuff becomes really easy. So I'll give you examples. So my first one, this is a little bit about how Mode's architecture works. So on the far side of this slide, you have Mode. Mode is a web app. It's in the cloud. What's happening when you execute a query in Mode is we're sending that query through a REST API to an agent that lives in your customer's secure environment. So like for Clover, it's Aptable. In other cases, it's like a VPC in Amazon, something like that. Query executes in the database locally, and then sends the data back to Mode, which we then display in the browser. This is different from some other analytics products where they just take all of your data and cache it in the cloud. The problem with caching data in the cloud is, like, if you're going to run advanced queries on that data, then it has to live unencrypted, which is like a little scary to me generally, but a total no-go in the world of HIPAA, right? Like, that data's got to be encrypted from end to end. So there's a whole category of products that's just like out the door, you can't use them because they have fundamental infrastructure problems that prevent that. We weren't thinking about that when we first started the company. We were just thinking about, like, security and doing the right things. Like, what is the thing that is most likely to leak data for anyone, regardless of whether you are in healthcare or in finance or just like the tech company down the street. Another example that I think is maybe more interesting is a thing in the product. And this is really, like, I think this is what counts the most. Obviously, you have to, like, dot the I's and cross the T's as far as, like, adhering to all of the regulations that HIPAA puts forth. But there are things like sharing that are a little bit more gray, right? So one of the things you can do in Mode is, after you complete some work, you can copy a URL and send it off to anyone at your company. I mean, it's a URL, though, so you can send it to anyone, technically, right? But I mentioned Dropbox earlier. If that's a Dropbox link, anyone can look at it. So I send it off to someone in the company. They don't realize that it's a piece of sensitive information. They send it off to someone else. Like, then you maybe have a problem, right? And worse, you don't even know that you have a problem because that link can't be tracked. We made this decision in Mode right from day one that in order to see this link, you've got to be in the same company as the person who sent the link. And we're going to have verified your email, and you're going to be logged into Mode when you look at this link, right? So you have to go through a series of checks in order to see this thing. And that's not necessary for HIPAA compliance. It turned out to make certain things easier for us. But I would say, like, it's this attitude generally of, like, thinking not just about our infrastructure, but about, like, let's make sure that we're not going to, like, accidentally goof or allow customers to accidentally goof. This is part of what makes Mode useful and part of what brings companies in regulated environments over, right? It's like, let's be thinking about safety from the very beginning. We sacrifice something in this, right? Like, there are customers who want to be able to share things outside. In fact, like, there may even be people in this audience who are, like, pissed at me, who, like, want to share stuff outside of their companies and can't. And we're okay with that because we want to protect really sensitive information. So to sort of wrap, there's kind of like two things that I would say were, like, the main points here. The first one is the use of data in regulated companies is not that different from the way it's being used in non-regulated industries, right? At least from the perspective that we see, where it is about collaboration in the sense of there's some kind of team that's doing really advanced analysis to drive the business forward, and it's about effectively getting that out to other people in the business and making them useful, right? Making them make better decisions in their job. And it's not really just about regulation, right? Like infrastructure and like crossing all the T's and dotting the I's, that's super important, but like you also need to have a balanced approach that's going to like consider risks in addition to just like pure legislation. Questions? Oh, thanks. Yeah.
So my understanding of HIPAA compliance is it's not exactly these are the laws, it's kind of like these are the guidelines, and then you have to, is that correct? And then you have to kind of translate that into how it plays out in your business. And maybe you could just talk a little more about how you went between the guidelines and what you have to implement.
Yeah. So the question is, HIPAA is a set of guidelines. You actually self-certify. There's no like certification board that says you're HIPAA compliant. So like, how did we interpret the rules and how do we balance that? It turns out to be pretty annoying. In fact, like that was the hardest part of the process, is interpreting that, because a lot of the rules are meant for like doctor's offices. So when you go and like try to understand what HIPAA means, it's like, well, here's what you're supposed to do with medical records that are lying around in your office. We don't have medical records lying around in our office. And in fact, like the only PHI that's coming into mode is because like customers of ours like Clover are writing queries and then that data is coming into our system. So part of it is about interpreting this. And I think, again, it kind of goes back to attitude of like, okay, well, let's bias towards being really safe and secure and like think about things like, okay, well, what if Clover like, or anyone for that matter, like writes a query where there is like PHI in the text of the query itself. We have to be able to deal with that in a way that's like totally compliant, which also means like training all of the right people in our staff on like what PHI is, what you can and can't do with it. We had to come up with like a series of company internal policies that are like, hey, if you see some kind of data, you basically need to destroy it. Like we have a 10-page document that outlines like what you're supposed to do as an employee with basically anybody's data. Like it actually applies to all of our customer data, but HIPAA was sort of the thing that like really inspired us to go deep on this. Yeah, I think there are. I think the other thing to consider is that there are services like Aptable that are like HIPAA compliance in a box, and we considered going that route, but it turned out to be really hard to get data flowing in and out. Like there were a number of administrative problems, and I think like Amazon, for what it's worth, is really good about HIPAA compliance. Like they have standard BAAs, they have a series of like things that you need to do in order to be considered HIPAA compliant. They take care of tons of the sort of physical stuff, like the way that they maintain their data centers. It's like kind of already good to go. So like just a normal Amazon infrastructure with like a few of the right security checks in place was enough there. Yeah, in the back. Yeah, I mean, the sharing decision is certainly one that fits into that, right? But like the point of our job in a regulated industry is like, don't leak the data. I happen to think not leaking the data is like an existential problem for us anyway. Like, if you use a data analysis product and we like just kind of goof and even if like we give you the tools to leak the data and you do it yourself, that reflects really poorly on us. And that's part of why we bias in that direction, is because like it's not worth it. We definitely have people who want to be able to share outside of their own company walls, and we'll do that when we have a way to make it like pretty secure. Yeah, there's also like a product trade-off there. So, if we were to develop two separate products, one for regulated industries and another one, it's just like slows our team down, right? That's like fewer good core product improvements that we're making. And so part of it is also like, let's not split the team in two and start working on these two separate products. Like, in the time that it would take to do that, why don't we just like do it the regulated way and then add a bunch of extra stuff that's going to work for both audiences? Yeah. I'm sorry. It's a how do we prevent? I guess so. So the question is about preventing vendor lock-in. We're kind of locked into Amazon anyway. And I think like a lot of our customers are. I mean, like Amazon seems like just sort of a default choice for probably most of the companies that all of you work at. Like if the companies were started after 2010. Yeah, I guess I just don't see it as that much of a problem right now because Amazon's like pretty cheap also. Like it's the default product. Like Redshift, for example, is kind of like the go-to for people outside of regulated industries. So it seems fine if you are in a regulated industry. I'm told I can take one more. All right, maybe that's it. Thanks, Clover.